It's 6:45 this morning. If you caught this earlier this morning at 5, 13 Investigates told you about a state report that says Indiana does not have enough school nurses.
Our Sierra Putman surveyed schools all across central Indiana, and in her investigation, she found that 48% of them do not have the recommended number of nurses to help your students if they need one.
This nurse shortage was always a problem, but the pandemic plus low pay just made it worse for schools.
This is my emergency drawer.
We followed Tamika Gerard West as she made cold packs, handed out meds, and checked on sick kiddos at Center for Inquiry 27. She says her first year as a school nurse is fun and busy.
520 or so students here, and everybody counts on the school nurse.
13 Investigates learned many central Indiana districts don't have the state recommended one registered nurse for every 750 students. This report from the Governor's Public Health Commission says it's a statewide problem. The group wants Indiana to create policies to improve ratios and to recruit and retain talent. One way to do that, address low pay. Kayla Preschek says she became a school nurse when her son started school. It was shortly after the Sandy Hook Elementary School shooting.
My husband and I came together and said, I think that there are some things that we could do.
7 years in, and she loved the work, but the pay no longer worked for her family.
There was never a time that I was able to just be a school nurse.
She made less than $30,000 a year and had to take a second job. Joyce Sunday is with the Indiana Association of School Nurses. She wants the state to chip in more money so districts don't have to come up with it all on their own.
I know we can't compete with hospitals. I get that, but we need to be able to compete. We need to be able to attract.
15 central Indiana districts shared their average pay. The lowest hourly rate for an RN was $20 an hour. The highest, $45 an hour.
You could have made more money as a travel nurse,
Yes.
but as a school nurse, you have better benefits.
Yes, and peace.
She thinks other incentives, like help with student loans, could attract other nurses to schools.
Right now, the legislature is reviewing the new budget. There's more money for healthcare and schools, but not specific funding to pay for school nurses. Sierra Putman, 13 Investigates.
Sierra also learned that some schools are moving away from looking at ratios to tell if there are enough nurses, including the National Association of School Nurses. So she'll have more on that part of the extended story online. You can just go to 13 Investigate section of WTHR.com.